Hello there.
Hi.
Hi, my name is Frank. I'm actually one of the student nurses here at the hospital. I'll be taking care of you today, okay?
Okay.
Okay. I'm going to get my hand sanitized. Okay. I'm going to provide for patient privacy, and I am going to check and double check the patient. Can I see your ID band, please? Can you state your name and your date of birth?
Nally Grubbs, 6/15/94.
Okay, it all checks out. I'm going to check the environment, see if it's safe. All looks good. So what brings you in today?
Chest pain.
Chest pain.
Mm-hmm.
Okay. Do you know when that began for you?
A couple days ago.
A couple days ago. Okay. And what parts of your body does it hurt the most? I mean, you mentioned chest pain, but can you point with your finger of where it hurts the most?
Just in the middle of my chest.
Middle of your chest. Okay. Do you know how long this has been going on for?
Mostly just the last couple days.
Last couple days. Okay. Let's see here. Is there any? Can you describe like the pain? Is it throbbing or sharp or?
It's like a sharp pain.
Sharp pain.
Mm-hmm.
Okay. And then let's see here. Is there anything that you do that may alleviate those symptoms?
Sleeping.
Sleeping helps.
Resting.
Resting. Okay. Anything that you've done that makes the pain worse?
Being overactive.
Okay. Overactive.
Yeah.
Okay. Is there a certain time of day that the pain is worse or less worse?
Like at noon.
Okay, around noon.
Mm-hmm.
Okay.
Mm-hmm.
And let's say on a scale of 0 to 10, 10 being like a shark is ripping off your arm, and 0, no pain at all, what would you rate your pain at today? A 4. Okay. I'm just going to ask a few more questions. So your medical history, let's ask you particularly about this chest pain. Have you gone into the hospital for chest pain before?
No.
No. Okay. Have you been hospitalized for anything in the past at all?
No.
Okay. And have you had surgeries at all for anything?
I got my tonsils removed.
Tonsils removed. Okay. And to the best of your knowledge, do you know if you're up to date on all your vaccines or immunizations?
Yes, I am.
Updated? Sure. And do you have any knowledge of any people in your family, like your father, your mother, grandfather, or grandmother, that has any chest pain or any form of heart attack history or blood pressure history?
No.
No. All good in the heart? Okay. I was just curious also, are you on any prescription medications? No. Any over-the-counter drugs?
No.
Okay. Are you taking any herbal supplements?
No.
Not at all. Okay. Do you know if you're allergic to anything, like medication, food, anything to the environment or latex? No known allergies?
No.
Okay. Have you had any history of tobacco use in your life?
No.
No. Have you had any history of alcohol use in your life?
No.
No. Okay. And have you had any history of drugs like smoking marijuana or methamphetamine? No. Okay. Would you say where you live, do you feel safe?
Yes.
Okay. So your neighborhood is a good, safe place?
Yes.
Perfect. Okay. Patient appears comfortable. Patient is in a great posture. She has the appropriate dress for the weather and the season. Patient looks like they keep great hygiene. They are at a high level of comfort besides the pain in her chest, looks like. I just have a few questions. Where are we right now?
Wasilla, Alaska.
Okay. And what's your name?
Denali Grubbs.
Okay. And what time is it?
8 p.m.
Okay. Patient is alert and oriented ×3. And patient's voice tone is right on the money. Her speech rate is great. She's not repeating herself. Next thing I'll need to do is take your vitals. Is that okay? Okay, so the first thing I'm going to do is I'm going to take a 2-step blood pressure. I'm going to get your systolic blood pressure right now. So I'm going to put on this blood pressure cuff. Do you have an arm preference?
No, whatever's easiest.
Okay. All right, I'm going to put this on you here. Okay. Over that brachial artery. Okay. I'm now going to take the blood pressure over palp.
Okay.
.110 over palp is our first step on the blood pressure 2-step. Next, I am going to take your pulse.
Okay.
Blood pressure in the left radial arm is 76, regular with a 2+ strength. Respiratory rate is 20, regular, deep, and unlabored. Patient mentioned that her pain was a 4 out of 10. Now I'm going to take your blood pressure.
Okay.
Is that okay?
Yeah.
Okay.
Sounds great.
I'm going to pump up 30 past the systole of my blood pressure over pulp. Blood pressure is 110 over 58. Now I take a patient's temperature, put this underneath your tongue. Temperature comes back at 98.6 degrees Fahrenheit. Now I'm going to check heart sounds. that's okay.
Sounds
So I
good.
need to check 5 positions of your heart. So I need to check 5 positions. I'm going to use the diaphragm of my stethoscope to check the first position, which is on her right side, and it's the aortic. I am listening for the S2 sound. Second, I'm going to listen to the pulmonic, and I am on skin to hear better. Third, I'm going to go to Erb's point. Fourth, I am going to go and listen to the S1 sound on the tricuspid. And fifth, I'm going to search for the mitral valve, and I will hear the S1 noise here as well. Pulse sounds normal with a strength of S2. No evidence of any wrong sounds. Next, I will do the capillary refill on all extremities. So if I may see your hands, please. For 5 seconds, and I'm going to release. Takes less than 2 seconds to refill on both extremities bilaterally. Perfusion's great. And I'm going to look here at your feet as well. I can grab a toe. Five seconds, less than 2 seconds. Perfusion in both extremities and our lower body shows that perfusion of blood is working well. I am going to also check your lower extremity for edema.
Okay.
No evidence, so a 0 for hidden edema. I'm going to check your dorsalis pedis, which is going to tell us your pulse rates to your lower extremities.
Okay.
And I'll be checking these bilaterally. Pulse rate dorsalis pedis is going to be at 66 bilaterally with a +1 strength on both sides. So that does it for the cardiovascular. Next, I'm going to need to assess your respiratory system. Will that be okay?
Yes.
Okay, so I'm going to check some breath sounds on your front, back, and on your sides.
Okay.
So I'm going to place this nice warm stethoscope on your front, and I'm going to ask you to breathe in and then breathe out. So
Okay.
take a deep breath in and then a deep breath out. Okay. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay, can you lift up your hands, please? Okay, breathe in. Breathe out. Breathe in. Breathe out. Okay, I'm going to get on the back here. Okay, go ahead and breathe in. Deep breath out. Okay, deep breath in. Deep breath out. Deep breath in. Deep breath out. Deep breath in. Deep breath out. Okay, I'm going to get on your side here. Go ahead and breathe in deep. And deep breath out. One more time. And then I'm going to get on this side here. Deep breath in and out. And in and out. Okay, so I would be auscultating on skin. So deep breaths, regular. They were unlabored on all points. There were no signs of adventitious wheezing, rhonchi, or crackles. Now I'll need to assess your abdomen, if that's okay. I'm going to listen to the 4 different quadrants in your abdomen. Does that sound good?
Sounds good.
Okay. First, as I'm assessing the abdomen, I notice that it's flat. Skin tone and color is normal per her race. I'm going to assess the lower right quadrant first. And this would be on skin. Now I'm going to move to the right upper quadrant. And I'm going to listen with the diaphragm on skin. Next, I am assessing the upper left quadrant. And I'm going to assess the lower left quadrant. Upon assessment of 4 quadrants, I hear normal active bowel sounds. Upon its further inspection of the abdomen, I don't see any abdominal pulsations. And upon my palpation, can you feel anything, any tenderness at all? Okay, upon palpation, there is no tenderness. Okay, thank you so much for taking the time for this assessment. This is all good information I'll be able to pass on to your primary care provider so that he may do more of a further assessment.
Okay.
Okay, thank you so much.
Thank you.
Yeah.